one of 4 cardiologists here at Nelson and also looking after Marlborough Hospital. If you're watching this today, it's because you need a procedure called a coronary angiogram. You would have had that procedure because you've either had a test as an outpatient which has indicated that it's necessary, such as a treadmill test or exercise echocardiogram, or perhaps you've been admitted as an emergency through either the Marlborough or Nelson sites. I appreciate there's a certain degree of apprehension associated with this procedure. Now, I can't take all that apprehension away, but I hope by introducing you to the people that will be caring for you today and explaining the procedure to you, we can do what we can to alleviate at least some of that apprehension. First, I'd like to introduce you to my other consultant colleagues. We're all general cardiologists and all very experienced in this procedure of diagnostic angiography. But in addition, we all have our own areas of expertise.
Okay, that's great. Right, we'll just try and get this catheter in.
Dr. Tammy Pegg is an expert on heart failure.
Okay, ready for the first shot, please, Jules? Elio-cranial.
Dr. Samuel Wilson, like myself, is an interventional cardiologist who can put stents in if required.
So it means when we stent him, there's going to be plaque shift into there. But obviously this is going to be very easy to treat percutaneously.
Dr. Andrew Hamer is an expert on congenital heart disease and also genetically inherited heart disease.
It's good prognostically and symptomatically, a much quicker return to normal life and working on the farm. So
no reason that he couldn't have a drug-eluting stent.
Valerie will explain what's going to happen during your stay with us.
So we're just going to take pictures, look at them, from the time that we put the little nick in the skin to go into the blood vessel to the time we tell you that we're done looking at your blood vessels. It's between 6 and 12 minutes.
Quite quick.
Yeah, it's very quick. Even though you're going to be in the hospital all day, basically getting checked in, having the procedure, going back for recovery, and then being discharged, the actual procedure itself is really quick.
And you go home on the same day?
That's the goal. All right, now there are a couple of different ways that we can go up to the heart. We can either make a small incision here in the blood vessel and go up to the heart this way, or we can go up through this blood vessel here to the heart. Now this one is a little bit more narrow than that one, but either way, it's about the same distance from here or here to the heart, especially when you take into account that hook there. So we will use that as a way to get to your heart, and when we get to the heart, all we need to do is puff tiny bits of solution down your blood vessel so that we can look at your blood vessels. We're looking for narrowings, and they will show up as little pinched in areas on the blood vessels. This is actually a 4-page document. The first chunk here is actually asking permission to do the procedure, all right? And then there are portions here that talk about what if there was any complications, what would we do? Down here is a list of the more common risks for the procedure, and I'll go over that in more detail in a moment. But I want you to know that it's all right here for you to review and review with others at home if you'd like.
When you arrive at the hospital, you'll be directed to the day stay unit where you'll be looked after by Bert.
You're here for your angiogram, so come to your bed and we'll get you ready for the procedure.
Thank you.
Is there anything you're allergic to at all?
Penicillin.
All right.
What's this for, Bert?
To enable the cath lab to put in their drugs, all right,
Oh,
for sedation and if they need pain relief. Okay? All right.
This is the interventional suite. It's also known as the cath lab. Indeed, this machine really is just a fancy X-ray machine that moves in many angles to allow us to take the best pictures of your heart.
Hi Colin, my name's Tracy.
Tracy.
Hi there, I'm one of the cardiac techs. I'm just going to put some electrodes on. I'm just going to pop them in spots that they won't show up on the X-ray machine.
All right.
I can just get you to lift. That's the way. I'm just going to attach the wires. And if I can get you to just lift your head for me, please. And just relax back. Thank you. We are all attached.
You're all wired up there. As promised, I've got some sedation here for you.
Good.
Just going to pop that through your IV line. Now, while I'm doing this, Valerie is going to come and prepare your wrist. She's going
Karen
to
is your advocate. She will be with you throughout the procedure.
Just relax and go with this.
Now I'm going to go ahead and shave your wrist just a little bit, right in the area where we need to go in, okay? So just a couple of hairs off there. Excellent.
Hello Colin, I'm Julie, I'm the radiographer. These are the screens that the images will be projected onto when we're doing the procedure. If you can keep your head on the pillow for me throughout the procedure, and I'll show you the images at the end, okay?
Okay.
Jill is the nurse who will be assisting the
Just gives
doctor.
us a nice clean surface to work from. All right.
Okay, so the first thing I'm going to do is I'm just feeling for your pulse. Okay, and then I'm just going to pop a little bit of local anaesthetic in.
Okay.
Might sting like a bee sting, but then it'll start to go numb. You shouldn't feel anything else. Okay.
It's the worst thing, Colin. It's the worst part.
Okay.
Mm.
Okay, Colin, I'm just going to bring this screen down. This just protects my eyes from the x-rays because I do a lot more of these than you'll ever have. And I'm just going to move your head underneath the camera now. Okay.
Nice and a wire.
Okay. Feeding out. Draw back. And that all looks good. Thank you.
There's pressure.
Okay, perfect. Okay, ready for the first shot, please, Jules? Iliocranial. And same again, please. Okay, inject. Thank you, that's great. Okay, that looks good. Jules, we may as well just do the four corners.
So Colin, these are your pictures. This is the catheter that sits at the edge of your coronary arteries, and when we put the dye in, it highlights up both the arteries on the left side of your heart to begin with. We're looking for nice smooth vessels of the same thickness throughout. Each picture we get is from each time we move the camera around your head. Okay, Colin, so this is the right side of your heart. This is where we found that you have a problem. As you can see, that coronary artery's got a little bit of a narrowing just in the middle. It looks like somebody squeezed their fingers around it. It's a little bit tight. So Dr. Pegg will make the report up, and then she'll discuss that with the cardiologists. Okay. But that's your finish for today.
Good, thank you.
The angiogram is simply a technique that allows us to take pictures of your coronary arteries. Once we've taken the pictures, what we do next depends on what we've seen. Hopefully, you could have completely normal coronary arteries, in which case you simply go home. However, you may have some disease of the coronary arteries. That doesn't mean necessarily that anything has to be done. In some cases, just aggressive treatment with tablets is all that's required. In other cases, when the disease is more serious, we need to put a stent in or perhaps refer you for surgery. If you need a stent, it may be done at the same time as the angiography, or sometimes it can be done as what's called a staged procedure, when we've had a chance to look at the pictures in more detail with our colleagues, and we'll bring you back for this operation.
A stent is a small metal tube that goes into the blood vessel, and we place it there and we use a little balloon to inflate it. This is actually what a stent looks like. It looks like glorified chicken wire. And when that is in place, it allows the blood to flow through the center.
Lastly, if the disease is severe and complicated, a stent may not be the best thing for you. In this case, surgery is decided on, and you will be referred to Wellington Hospital for this operation.
Right, so this little device is called a TR band. What it does is it goes on the blood vessel, goes right over the blood vessel, and it pushes down onto that little nick in the skin and just keeps it stable while it heals so it doesn't bleed around it.
So where would the nick be then, Val?
Goes right over the spot where the nick in the skin will be. And then we would take out that little tube and we'd go ahead and inflate that with the little balloons with some air to help press down on that blood vessel to help support it while it heals.
See?
It's clever, isn't it?
Very.
It all went well and as expected. There's 3 arteries that sit on the front of the heart, and one of them in you has got a blockage in it that needs repairing. And that can be done in a similar sort of procedure to what you've had today, just with a little balloon and a stent. You'll just have to come back and it should be pretty much straightforward.
When will that be, any idea?
Probably in the next 4 to 6 weeks.
All right.
Is that okay?
Yep, the sooner the better now.
Sarah and Nikki are known as our cardiac liaison nurses. They will be on hand throughout the day to give you any more information that you require. And after you go home, they'll still be available on the telephone. If you've had a stent or a bypass operation, they'll also follow you up here at the hospital to make sure you understand what has happened and what your steps are for the future. So that's our team. We do this every day. We're very good at what we do, and you can relax. We'll take good care of you.